Okay, we are going to run through a quick, effective and efficient circuit with your birth ball. This is something that you can spend time doing daily, all right? So make sure your birth ball is the right height for you. Your hips should be just higher than your knees, and you should feel nice and stable on this, all right? You are going to notice that'll help you sit a little bit more comfortably, help you engage your core a little bit more, and your pelvis will be in a better position rather than just sitting on a chair. All right, so we're going to get started. We are going to do some hip circles. All right. Now with our hip circles, we are really looking to boost that pelvic mobility for you. All right, we want to not just do little circles here, we want to really get into the corners. I often call this belly dumps the hips, all right? Make sure you go both ways. This is going to help to mobilize and open up the top of your pelvis. For all of these moves are actually going to help you be more comfortable in your pregnancy, but it's also going to help you prepare for birth and make sure your pelvis and your belly and your whole body doesn't hold tension that is going to inhibit and slow down your labor, all right? We want that to be nice and efficient and positive experience for you. All right, next up we're going to go pelvic tilts. Again, this is a top of the pelvis opener, so practicing movements like this, so from the side, is going to help open the top of the pelvis and help baby be able to engage into the top of your pelvis. We don't want it to get stuck or blocked in any way because the top of the pelvis, the spine, or the front of the pelvis, the pubic bone, is stopping baby. Baby needs to be able to get in over those bony bits. Okay, so being able to round in the back and tilt forward is just going to allow baby to shimmy into there nicely, and it's also probably going to be reducing a little bit of back tension that you might be holding here. When we're tilting up this way, think about zipping up, engaging that core from the top, like you're giving baby a little hug from the bottom up. All right. Next up, we are going into side-to-side movements. So we're going to go, again, nice, good mobility into the sides, helping to release tension throughout your pelvis, maybe even into your upper body, all around your core, all those ligaments, all around baby also. So this is mobilizing your mid-pelvis because you can see your pelvis is doing something slightly different on one leg to the other. Okay, this will help baby move, create more space in the mid-pelvis so that baby can move and rotate through your pelvis to come out. We don't want any roadblocks there. We don't want any stiffness in your pelvis that might slow or stop that process. All right, and another one we can add to that is figure of eights. Make these hips move. Thinking belly dumps the hips. Make sure you go the other way. Good job. A squeaky floor like I do for the bottom of your ball. Okay, and then we can add to this a little bit more. So have your feet a little bit wider. Again, you should feel pretty stable here. Make sure you can have something to hold on to if you feel like you need it. All right, and we're going to come back, and then we're going to go the other way. And add, feel that little bit of a stretch down the front. These inner thighs tend to get a little bit lazy in pregnancy because of all the posture changes, and they can cling and clench. So when lazy muscles kick in, they can be a little bit tight and clenchy. They also connect into your pelvis and your pelvic floor region. So we want this whole region to be nice and flexible and not hold any restriction or tightness, so that we don't stop baby coming out easily. It's also going to help with your comfort, of course, during your pregnancy. Now we can add a little bit more of a stretch here and reach over. And again, what your arms are doing and the muscles surrounding your arms and your back, they can all influence how your pelvis mobilizes and moves as well, because posture changes happen throughout your whole body, especially into that back area, lots of tightness and tension. Okay, so keeping these arms mobilized in different ways as well is also really helpful. Okay, we're going to come down onto the floor, so we're going to be kneeling onto the floor. We're going to kneel over our ball like this. Get yourself comfortable. You might have your knees a little bit wide here and your feet more narrow, like so. And we can rock back and forward, and we might feel that pelvis, that back round as we really roll back. Okay, so we're tilting that pelvis. This might be a position that you instinctively use during labour to help baby let its heaviest part, the spine of the baby, we want baby facing up the back, to be in the best position for labour, to start labour, for baby to get through your pelvis easier. So we want that baby to be head down and back facing towards the front like a little hammock. So this is a good position to spend lots of time in your pregnancy for comfort, but also get used to mobilising your pelvis like this. All right, we are going to, you can do this as, you can do all sorts of movements here, so we can just rock side to side. Okay. Again, practicing mid-pelvis movements, taking tension out of your inner thighs and your pelvis. Lots of things we can do that are really beneficial with these birth balls. And then we can go up, so we can have our arm, we can be like this, our leg up, sorry. So again, we're getting a little bit of that pelvic inner thigh stretching. Okay, now you want to have your pelvis forward as much as you can. Remember, with pregnancy we've got a lot of hormones floating around. We don't want to overstretch, so just rocking in and out, using your ball for that support. You can take your arms into it if you want to. You can go forward. There's so many ways that we can do this, and what you're able to manage is very much up to you. Make sure you do it on both sides, and if you feel one side's a little bit tighter than the other, do a little bit extra on that tighter side. All right, so there you have it. There is a quick birth ball circuit exercises, movements that you can include in your everyday life throughout the rest of your pregnancy, and you'll probably confidently be able to reach for your ball during your labour and just instinctively move through it, because your body is amazing in labour. It knows how you need to move for baby to get into certain levels of your pelvis. So highly recommend it, and make sure you've got a good solid quality ball that is going to make you feel stable and in the right position with your pelvis. If you're looking for more exercises, more movement, really proactive about wanting that natural birth, then you can do lots more movements and intentional exercise, understanding the process of labour so that you can really go into your labour feeling as confident as possible, with lots of strategies that is going to help you manage the intensity of your labour, as well as being able to move well, so that you have the tools that will help ease that intensity, but also allow your labour to progress confidently. So I do have an online birth prep program that covers all of that, including breathing strategies, because your breathing muscle is at the top of your core system, and it's very much all connected, and also really good for mindset to get you through. So there's lots of little tools and strategies and guidance on there in this 7-day online program. Super easy and low key to follow at your own pace, and include and show your partner, so that they can be very helpful, because your partner is super helpful for your supporting you in such an intense time during that labour process. So I will pop the link for that in the bottom.